Hi, Mr. Augustus. How are you today? Dr. Schlesinger, as you know, we met in the office last couple weeks ago and discussed your problem that we're here today to try to resolve. As you recall, you came to me originally with pain that was radiating down the right leg and developed a foot drop, which is the inability to pull your foot up, which is the main reason why we're going ahead today and carrying out this microscopic discectomy surgery. Is we're going to try to get the pressure off the nerve by removal of the fragment by making a small window, bone removal, and then removing the pressure off the nerve, and then removing the fragment that's hitting into the nerve in the case of your situation. Sometimes it's just narrowing from the bone and ligaments buildup without a herniated disc, but you've got the luck of both. So what we're going to do today is we're going to remove the bottom, the 2/3 or so of this L4 lamina, and the top half or third or more of the L5 lamina in the medial part of that facet joint, and that's called a microlaminectomy, decompression, and discectomy. And in doing so, there's going to be nerves that are going to be going down this way that will free up, number 5 and number 1. And then there's a nerve coming out through here, number 4. And then there's a fragment of disc that we're going to remove. We'll also remove the thickened ligament and part of the joint here that on the underside is hitting into the nerve. All of this we're going to do through a very small opening and through a portal that's going to allow us to do this using the microscope and do a microlaminectomy, hemilaminectomy really just on one side, which means half, so hemilaminectomy of part of number 4, part of number 5, and the part of the segment that joins the two together. But that'll get us down to multiple nerves that pass through this area, and we'll free up all of the nerves in the area that we need to. And then there's a fragment that I'm going to remove of the disc, which is the cushion here between the bones. And part of that, in your case, has broken loose and is pushed back into the nerve, causing that foot drop and the numbness. We're going to deal with all of those problems all through the same operation. Now, anything loose from this space, I will reach down in with my microscopic probes and I'll free up anything that's loose and may want to come out someday in the near future. We'll try to get that, reduce the chances of that happening to the lowest level possible. I'm certain, always discuss, with you that there's alternatives to treatment that can be tried in many cases, like physical therapy, medications, and spinal injections are the most common of the non-operative approaches. In your case, unfortunately, with a foot drop, those don't tend to work very well because the damage is to the motor fibers pulling the foot up. So what we hopefully achieve is getting that nerve the best chance of recovery and hopefully the long-term prognosis of being able to control your foot properly and not trip and stumble, as I'm sure you've noticed, will be improved by getting the pressure off of it. And now there's always a risk of surgery, from the anesthetic risk to the wound healing problems or wound infection, bleeding, damage to the nerve, damage to the covering of the nerve. Any structures around the spine could be altered unfavorably with surgery, but it's very uncommon, very rare to get a problem of any significance. Now, there is a chance of having another problem someday. And in fact, I think that we probably talked about you've got other areas of problems, but we're focusing in on the one that seems to be the cause of your current condition. Our goal here, we're in an outpatient setting. We're up the same day, we're walking. The operation we do through a very small port. Microscopically, we're trying to minimize the post-operative pain, to speeden the recovery, and improve your quality of life, and the speed at which you return to your normal quality life, all through the minimally invasive surgery which we're doing today, as opposed to a more standard open procedure with more tissue disruption and more chance of blood loss. And in the outpatient setting, the other benefit that we really enjoy is that we're in a setting of healthiness, and people aren't sick around here bacteria and colonization of infections that they are typically more apt to have in a hospital setting. So we're hopefully be able to do this in a more comfortable, lower infection risk environment and more cost efficient to you and your insurance company, or other reasons that we've chosen to be here at Legacy Surgery Spine Center. The typical recoveries from this surgery is about 6 weeks till you're up and able to get back to your pretty normal life. And again, there is a risk that you could have another problem someday that might impede that plan, or it may interfere with that plan down the road, but in general, it's about a 6-week recovery. Well, thank you very much for agreeing to let us visit with you in front of the World Wide Web.
There is lab results that you will have to obtain prior to your surgery. If you are having your surgery at St. Vincent's Hospital, we will set you up for a pre-testing. If you are having your surgery at Legacy Surgery Center, we will need you to obtain the lab work at a hospital closest to you. A nurse will be giving you a call 1 to 3 days prior to your surgery. At this time, you will be notified what time to arrive to the surgery center or to St. Vincent's Hospital. Prior to surgery, we will need you to obtain HibaCleanse. You can get this at any pharmacy. You will use this cleansing solution on your procedure site for 3 to 5 minutes the morning of your procedure and the night before the procedure. Be sure and remember nothing to eat or drink after midnight the night before your surgery. Also, do not use any tobacco the morning of your procedure. If you are having neck surgery, we ask that you wear a button-up shirt. If you are having lower back surgery, we do ask that you wear stretchy pants, something easy to get on after surgery. You must have a responsible adult with you the day of your surgery. It is common after surgery to have a low-grade temperature. Coughing and deep breathing and walking around is the best remedy. If you have an active infection or any new medical conditions, please notify our office as soon as possible.